Today is our 13th town hall. Today, July 27th, if you can imagine how long this coronavirus environment has been impacting us. And just for our final quick disclosure, just remember that Arkwood Financial LLC, Arkwood Benefits Consulting Inc., and Arkwood HR LLC, you obviously know us as Arkwood. We are independent companies of which we are not offering legal or tax advice. Our goal is to provide information to you for assistance in making decisions for your company. We leave the legal and the tax work up to the professionals, i.e. that's why we bring in smart guys like Dennis Hall and Matt Hatfield to join us today. But with this, I would like to turn it over to Diana and Dennis. Welcome aboard.
Thanks. I can't believe that we have been, that we are now halfway through the year, more than halfway through the year, and that we have been dealing with specifically COVID-related items for a full 5 months of these 7 months that we have been through already this year. It's kind of crazy to think about all of this.
We did pinky swear that we weren't going to go down the COVID fatigue road.
not today, but it's definitely something we probably should talk about at some point.
Right.
And helping everybody. So, as most of you know, and he can put up our first slide for us, as most of us know, Governor Ducey last week said that bars and nightclubs, gyms, theaters, water parks, tubing is closed indefinitely. He will be reviewing the data on tests and positive results and hospitalizations every 2 weeks to make a determination of if and when these groups will all get to open again. Also tied to that is restaurants are open, but they're at a less than 50% capacity. And so still a lot of takeout, delivery is happening, though in dining at a much lower capacity is happening in restaurants. And that no organized public events of more than 50 people are allowed indoors or out, and just making sure that we are keeping the state safe. And then tied to all of that also is schools. They say they want learning needs to start as soon as possible, but they haven't given us any real guidelines of what that means. Each district is going to be allowed to make their own determinations when it comes to their schedule, though online and in-person options need to be available to provide parents that need assistance. Either they don't have internet, need assistance with helping their children with study capabilities, that in-person option has to be available at some portion of the school process. And our Department of Health Services here in Arizona is supposed to have benchmarks for schools to follow with regards to face masks and social distancing by next Friday. So we still have a couple of weeks before we will hear from the department on what that actually looks like. So we're going to continue to keep an eye on all of this and figuring out what is next here in the state. And then tied to this as well is unemployment insurance. So the CARES Act, the original CARES Act that happened in March, the $600 additional unemployment payment ended in all states on Saturday. So that additional payment will not be happening, at least effective today. If the CARES Act ever gets passed, or when it does get passed, we do anticipate there will be a new unemployment option in the plan for the states. We don't know what that looks like. I know the Senate is looking at the 70% of whatever wages an employee was making prior to being laid off or let go. Though the states are pushing back on that because most of the UI systems in states can't manage that process. They're very antiquated systems. So there may be just a flat $200 extra payment, extension payment for unemployment under the CARES Act. We're not sure. The House Democrats are wanting to extend the $600 payment until the end of the year. So, like Pete said earlier, we've been hoping to know what this was going to actually be, but of course, we don't know yet. And then in Arizona, those that are collecting unemployment receive up to $240 per week for unemployment here in our state. And typically those benefits are paid out for up to 26 weeks. The pandemic UI assistance does provide for an additional 13 weeks of benefits. And that's irregardless of the $600 payment or the additional CARES Act unemployment. So we'll keep watching this and finding out what this is going to be looking like, but hopefully we'll have details on this soon from our government.
You know, you mentioned kind of antiquated systems.
Yes.
I know Bloomberg put out a news article that they did a study through Treasury and Labor Department data, and they're estimating that there's $100 billion of benefits that still have not been paid due to their systems.
Yes. Well, and they're finding that there's now fraud. There was a big fraud thing that happened here in Arizona, and accounts were emptied out that were supposed to have unemployment benefits in it and such. So yeah, the systems they weren't capable of handling even the $600 extension and the addition of money to people's accounts. I can only imagine what it would take to get them to be able to calculate 70% of everyone's wages when unemployment's at record highs right now. So it'll be interesting to see what happens.
Will be.
And then last but not least, of course, and Dennis will help talk about this a little bit, is our return to work. It's not a matter of when, but it's a matter of when, not if, a member on your staff becomes symptomatic or tests positive for COVID. And so this is just a reminder that when we do have a team member that is symptomatic or has COVID, to manage it with care and compassion. This is frightening not only for the employees that may be exposed, but for that employee that is now tested positive or has symptoms. So we want to treat this with care and compassion. When dealing with the employee's exposures, when we do have a positive test, making sure that we are managing it privately, that we're not sharing who the employee is, that we are stopping any gossip and rumor mills that are happening around it, and that when the employee does return, that they should not be treated differently, that they should not be put in a corner somewhere and treated kind of as an outcast. When we are notifying the employees of the exposures, thinking about notifying only those employees that would have probably had prolonged exposure to an employee with a positive test. So that means for longer than 15 minutes and in a less than 6 foot physical distance space. Have those employees watch for symptoms. They can either, having them quarantine. If they can work from home, have them work from home. In healthcare, employees are allowed to work even if they've been potentially exposed, as long as all the required PPEs are being used, physical distancing happening, if they are asymptomatic. So it's managing that process. But then tied to that is managing the employee fear, making sure that we are not only communicating our safety protocols, but listening to their fears. What is it that they're afraid of? How can we alleviate their fears? Managing that process from start to finish, as always. Right. But what do we need to do if we have an employee that says, you know what, I'm not interested in coming back. I'm scared, I don't want to return. I'm immune compromised. I don't want to catch this. There are a checklist of thoughts that we have to go through during this process to see if we may need to manage through the FFCRA, the ADA, or the civil rights at FMLA. And this is definitely where Dennis can help us manage through this process. And he's helped me manage through this process a couple of times this past week.
Right. We've at least what my experience is in the last couple of weeks, I'm starting to get more and more issues of employees who basically don't want to return to work. Fear is part of it. People, attempting to evaluate their situations is difficult. And as an employer, you'll have to understand the best we can what we know about COVID at the moment, which is difficult, and you'll see why. What we do know is we need to say the words airborne, airborne, airborne again and again. When we started this, everyone was focusing on contact, but as my reading is, and the difficulty, of course, is filtering through what is substantiated versus a lot of people just talking. But it seems like the consensus is that airborne exposure is what you need to worry about. I love the imagery of one little story about a building somewhere, I think it was in Australia or the East, 17 stories. Half the building was a call center, and the other half were offices. They shared elevators. They shared everything else. 50% of the people in the call centers tested positive, 1% in the other half of the building. The point is that call centers are like a choir. It's highly airborne. That's where risk occur. So think of that going forward. Now you have employees who are, for whatever reason, I've had employees who went back to work, and then there's some type of exposure in the workplace, and they say, I don't think I should be here. The answer of what you need to do as an employer is relatively complex, because each one of these situations depends on who the employee is, what their conditions are, how they're working, what they're working, who you are, and the reason they need to leave. That is, the lawyers like to call it very fact specific, but that's just what it is. You need to go through a quick analysis. We have under the Family First Coronavirus Response Act, our first legislation in March, 2 provisions. One is the 2-week off provision, and that's focused on whether the person themselves has to be quarantined, has symptoms, has a diagnosis from a doctor, is caring for somebody in a quarantine, or is caring for a child whose school is closed. That's 2 weeks off. So that really focuses on people with the illness or with some evidence of a fear of the illness or taking care of somebody. So, and that you have to say, who are you? Does that apply to me? Well, since it applies to companies with 500 or less people, more likely yes than no. But there are exceptions. The most significant exception is that medical facilities can opt out of this provision. So you've got to figure out who you are and who they are. The other part of that act is the Extended Family Medical Leave Act, and that's focused on caring for a son or a daughter who has to stay home, and you need to care for them because of the school closure as a result of a public health emergency like COVID. And there's an unavailability of their child care provider. That's 10 weeks off, at reduced pay. So now you have to, for that to apply, you have to have a child, they have to be off, and you can't telework with either of these. So the FMLA typically provides for 50, applies to companies with 50 or more people in a 75-mile radius. This applies to all companies with less than 500. So again, you look at who you are and why they want the leave. Does that apply? Again, healthcare providers can opt out. So if you have somebody who is, and I think the situation which is arising, someone who fears that they're going to get COVID, you have to look at it a little differently, because either these temporary laws don't apply to that. You do have to go back and worry about just typical employment law. And the most important area here is the Americans with Disabilities Act. So if someone comes in and they say, I can't work here because I fear getting COVID, I'm in a dental office, and I have an immune response issue. Well, now they have, if ADA probably applies to you if you have 15 more employees. And you need to look at it and say, well, what do we do? Do I have to provide a reasonable accommodation for this person? Well, they have a life-limiting activity. The answer is probably yes. But what is this accommodation? If they just want to leave and take time off, but they don't know when they can return, the ADA might say, and probably does, that that's not a reasonable accommodation. So it becomes, the question is, why are they leaving? Is it temporary? Is it permanent? What's their condition? Again, all of these are very, very complex issues, but you need to go through a decision tree like this to handle the worker who simply doesn't want to or can't work, they think, because of COVID fears or trepidation about their own situation. So that's something that if you have this, you certainly should call Diane and try to work through them and say, do I have to, do I have to return this person to work? Do I have to give them leave? There are even special provisions under the extended FMLA, and that if you have less than 25 employees, your duties to return a person to the same position is different than under the FMLA. So it's these provisions are out there. Take notice and try to do the best you can, but these are coming up rather frequently now. Diane?
Well, it's also, we're seeing more and more lawsuits and things coming up as well. So just because we're in this COVID world doesn't mean that we should still not be following best practices and treating our employees fairly, without discrimination, doing what's best and what's right for the company as well as our employees. So making sure that we're keeping that in mind as well during this process. Pete?
Sorry, I was on mute. I forgot to unmute myself.
We're only on our 13th one, Pete. So, I mean, it's the technology thing is...
I know, you'd think I'd be able to navigate through this more efficiently, right? But so you're really just, it's a dance between, what, 1, 2, 3, 4, 5, and then adding ADA in there for 6, navigating 6 different laws and or acts, really from any instance where somebody wants to stand.
That's the short view. There's many more.
Okay. So the summary of it is just be aware that it's never going to be an easy answer and call for help.
Yes.
Okay. I'm glad I was able to navigate that.
And it's case by case. So it's not a blanket decision that, oh, well, this is what I did for this person, so that's what I do for everybody. It has to be a case by case basis that we deal with all of this.
Okay. Okay. So anytime somebody is unwilling to come back to work for a myriad of reasons that Dennis has talked about, you have to step back, pause, and then really just start going through this checklist of the ands, ifs, or buts based upon the size of my company, right? The location, if I've got 50 workers in a 75-mile radius, et cetera, et cetera.
Yeah.
Right.
Okay.
Yeah, and there are workers who have the view that they can step away at will, and even if they're needed at work, and even if these conditions don't apply, and that employers will have to take them back at their urging, rather than at the employer's urging. And it simply isn't that simple. That's the difficulty, and that obviously could present itself for potential disputes with employees, and we're not in this to have disputes with employees.
And so Arizona is what, a right to work state? Is that the correct definition? That's
Yes.
where there was a conversation that you and I had, gosh, many years ago about how, like in our handbooks, we don't want to have a probationary period as an example, because in reality, we're always on probation, right? Because the employer has the opportunity to like act on separation of service. However, that's where the big but is in any of this, is because we always have to fall back on any of these rules. We can't just say it's not working out and terminate them. We actually have to go through this process before we can do that separation of service.
The exception is to the at-will employment rule is you can't discharge somebody for reasons that are contrary to public policy. And obviously COVID has added lots of public policy issues that we need to be concerned about.
Okay, cool. Thanks, guys.
You're welcome.